My name's Patricia Fogelman. I'm a DNP in palliative care, working in pulmonary critical care and palliative medicine for the last 27 years. For the last 14 of those, I've segued into palliative medicine leadership. I'm now director of the palliative medicine department at Mount Indy Health in State College, Pennsylvania.
I'm Chris Jones. I'm a palliative care doc at Duke. I'm our clinical vice chief, and I'm also the editor in chief of the Journal of Palliative Medicine. I'm a geriatrician, an internist, a palliative care doc, and spend all of my clinical time taking care of patients with serious illness. I run our outpatient program and also do a fair bit of work nationally around billing and coding, working with CAPC and the American Academy of Hospice and Palliative Medicine to try to help us get paid for the work that we do. The Four Seasons Immersion course is really a unique way to learn about palliative care. I've had a couple of advanced practice providers on my team go through the program. It's a week, it's all online, so the travel costs are minimized. It's a way to get a lot of high impact learning in a very short time. I feel fortunate that I had a year to learn this stuff during fellowship. But for a lot of our advanced practice providers or people transitioning toward palliative care or hospice care, there just isn't a year to spend learning the materials. What we've tried to do with the immersion course is give you content, but you can't learn all of this stuff by video or by lecture. So a lot of the course is learning a bit of material and then practicing it, learning more material, practicing it. The skills-based learning in small groups is really a different way to gather your skills and to build on what people have learned from Vital Talk or from Serious Illness Conversation Project. These are 3-hour courses that can help to push people's communication skills up, but there's just not enough practice in those sorts of environments. What the immersion course does is it takes a full week for information about communication, about advanced symptom management, about self-care, disease-specific palliative care, prognostication. There's really as much as we could stuff into this course we've done. And everything that you can't learn from just hearing about it has a practice element. That's really what I see as the big benefit to the program, the ability to gather information and then use it, and then gather more information and use it as a way to keep building skills on top of each other.
I'll add to that, Chris. The biggest advantage I find with our program is that our learning is in sequential blocks. It's hard to learn this material without having some sequence to it, some organization and structure to it. People try to piecemeal the education with a session here and there. It's harder to put it all together and drill it down into an effective practice. What I believe our course offers is all those dimensions: consultation etiquette. How do you go about initiating a palliative medicine consult? It involves interdisciplinary communication. How do you discuss this case with other members of the team? How do you collaborate and partner with them across the settings of care? The biggest thing about our program that I think is super unique is that everything we teach you applies no matter what setting you work in, whether you're inpatient or outpatient or in a skilled nursing facility or other residential settings. This is really a program that develops a skill set that you can take anywhere with you. So should you even decide to transfer down the line to a different setting of care, maybe from inpatient to community health, for example, these skills will not be disappointment to you. They're going to keep applying. They're going to keep being really valuable. And to give people things like talking maps, how to initiate a difficult conversation, protocols on treatment algorithms for symptom management, enables you to leave this course empowered with a good amount of information to start your practice, but then to keep building on it and to have a sense of confidence that you came into this ready to learn and you're leaving empowered and armed with a massive critical knowledge that you can apply in your practice. I frankly took this course when I initially took it as part of my board prep. I wanted to really have a very comprehensive overview of all the materials to help make sure that I was as ready as I could be to sit for the boards. And I found this to be far superior to any other mechanism of prep I was using at the time.
Yeah, I think about the immersion course as almost a one-room schoolhouse where we have advanced practice providers, we have physicians, we have social workers, we have nurses, and trying to make learning applicable to everybody and make it where everybody is able to leave the course with skills that they can use the very
Mhm.
next day. I mentioned that two advanced practice providers on my team went through the course, and we happened to work in the same office. Hearing their conversations with patients quite literally the week before and the week after the course, I said, there's some secret sauce here because the skill sets really just took a big step up from the 1 week of learning.
And communication is difficult. It's uncomfortable. It makes everyone sit on the edge of their seats, and we're all a little sensitive to how am I coming across? Am I coming across effectively? When we can teach people even the basic building blocks, reassuring you through the role plays, through the immersion. This is how you learn this skill set. Yes, we understand it's complex. Yes, we know it's nuanced. But if you can practice them in a really safe setting and not in actual real time with a patient, the chances are significantly higher that when you go to your real time setting, you're a lot more effective at that communication. I think this course should be a must attend for anybody on the healthcare team who interacts with patients with any kind of serious illness or any kind of chronic progressive illness that may become life threatening or life limiting down the line. I think this is a course that's ideal for nurse practitioners, physician assistants, physicians, social workers, other members of the healthcare team that might be doing this kind of work, which can include your RNs. It can also include chaplaincy. There's something in it for everyone. Just because you don't prescribe medication doesn't mean that it would hurt you to know which medication might be of better help to a person in certain situations. That enables you to say, this is a medication that might work better in this instance because this is how it helps these symptoms. Being able to say, how do I contribute? Everyone wants to work to the top of their license, everyone wants to work to their full scope. You have to be empowered with the right knowledge. So if you don't know how to approach complex communications, advanced illness planning, dealing with prognostication and patients who may be facing a potentially life threatening situation, you don't have the skill set to navigate them through what really is going to be a very difficult time in their life. And so these skills that we're teaching are really to help people become the best versions of themselves. Because if we're very frank about it, you don't need to be in palliative care for palliative care skills to be important to your practice. There's primary level palliative care, which is what we should all be doing effectively. And then there's specialist level palliative care. And I always equate that to if you have routine hypertension, your primary care doc can manage. But if you have some refractory, difficult, hard to manage high blood pressure situation, you need a cardiologist. And that's the distinction with palliative care. If you have routine needs, and we want people at the entry point of your care who do the day to day management, who see you the most, to be comfortable having those conversations with you. If you're getting more difficult to manage, more complex, then come to the specialist. That this course is designed anybody along that way to get something out of it.
I think the nice thing about the course is it's appropriate for a wide range of people. I think the folks who I've seen get the most benefit out of it are probably folks in two buckets. The first is the advanced practice provider who's transitioning from something else to palliative care, working in cardiology or primary care or pulmonary or nephrology, and a position opens up in the palliative care program and the person steps over. They've got immense knowledge in the space where they used to work. But some palliative care is different from primary care or different from cardiology. What we've done in our group is had folks who are coming over to our outpatient group specifically do some orientation with our colleagues within our group. And then within the first couple of months of their time with us, spend the week doing the immersion course. Because it's this Goldilocks question of when is it too early and when is it too late? Too early is when people don't know what they don't know, so they don't know what their gaps are and what they have to learn. Too late is when they've been seeing patients for 6 months and have developed a bunch of bad habits. In that 2 to 4 months of being in the palliative care space, that's really where I've found advanced practice providers, especially to get the most benefit out of it. The other group that we've trained a good number of are physicians who've done something over the course of their career. Again, primary care, cardiology, pulmonary. And for the second part of their career, they're going to be hospice doctors.
Mm.
And hospice, boy, talk about a skill set that's different from really anything else. And everything that we teach in the immersion course is appropriate for a hospice medical director. Advanced symptom management, through communication, through interdisciplinary teamwork, through self care, really anything that we've put together for the immersion course translates into the hospice space. Is there a bit more content that hospice docs need, especially around regulations? There is, but from the medical and patient management and interdisciplinary care side, the immersion course really knocks it out of the park in a very efficient way.
Dr. Jones and I have had great success with the immersive role play and also demonstrated role play. We've changed the format a little bit to be more of a mixed combination of both of those approaches rather than having every case study be an immersive role play for the students. There are some that we demonstrate so that the nuances and the complexities of those conversations can be better explored. And then we use the audience of our students as our hive for feedback. So we turn to the group and say, this is getting difficult for me. What would you do differently here? What do you think I should say here? Or what should I pivot to? Should I stop the conversation at this point? And these are really effective learning methodologies because these are mimicking the real life situations. I always tell the group when you come to the course and you're starting the role plays, you have to leave the discomfort at the door because you're in a very safe, contained group setting. There's no judgment. There's no harm to a patient here. We're really all here to support you, to help you, and to help you grow into a better version of the provider you're looking to be.
Patty, what you said there about this being a no risk environment to be able to practice things. You can imagine the ICU is a high risk environment for patients and for families. So being able to have these conversations and you step on your tongue here and there, and it's okay. Your classmates, the facilitators offer you feedback. I might have tried to say it this way or practice with these words. Any role play, which gives a lot of us itchiness from our training over the years, if it's done well, if it's done under Vegas rules, it gives you a way to try things out. It gives you a way to hear how other people speak, how other people would approach things, and decide that fits with the way I would do it, or that doesn't, but I might do it this way. You can learn a lot by watching it go well. You can learn a lot by watching or having it go badly. And what I always say to our fellows is put your nickel down, try something, squirt a little cortisol, and we'll learn together. This is an okay space to make a mistake.
If you look at the course, the cost of continuing education across the regions, the total cost for our conference is just under 3,000 for the week, and it's a 40-hour CME course. Most nursing conferences for even a day will run you $400 to $600. So if you look at the overall content of the material we're providing, the fact that it's really immersive, that it has detailed clinical knowledge, that we provide you with not just all of the slides we're using for the education, but then also reference material that we provide in addition to that, it still comes under what you would be paying for a routine conference if you were factoring in all the other costs. The fact that it's also virtual and allows you to do this from the comfort of your own home or the setting of your choice is the double benefit. You can be comfortable, dress how you want, sit in your comfy space, and just really be ready to engage.
I think that this is a really efficient way to orient people new to palliative care. If you need to try to get somebody up to speed in a month or two, you can do shadowing visit after shadowing visit, let them see a person in precept. And that's part of the orientation that lots of places offer. There really isn't another orientation option that I know of that gives you the content that you need in a thoughtful, sequenced way so that you can come in fairly green and come out a fair bit more of an expert in the content. So while there is certainly a institutional cost to this, it's just the most efficient way to level up your providers who are new to palliative care or to hospice care.
And I will say, speaking as someone who also runs a department, I have sent my new hires with no prior palliative medicine experience to this course. And they have come back far better equipped to deal with the situations we face, to have these difficult conversations, but also to have the symptom management skill that they didn't have going into it. So you can hire somebody who is really great with the potential to do well in this role and has a lot of the innate skills, but really just needs to be developed and learn symptom management, learn some more of the complex communication techniques. And this course, I think, pays for itself in terms of a provider who's better educated is likely more satisfied with their work, likely to stay. They feel empowered, they feel valued. Their input is likely to be more appropriate and relevant. And so patient care is streamlined, patients and families are happier, satisfaction increases. I think when you start adding in all the value, this is where the cost of this immersion week is really not prohibitive when you look at it in context of the benefits it's going to yield. Healthcare as a industry is changing and we're all being asked to do a lot more, sometimes with a lot less. There's a population, all of us are growing older, all of us are aging. We're all going to need high quality palliative care. To anyone contemplating this type of education, really pursue it and take this opportunity to immerse yourself in a course like this because the skills can stay with you and will endure with you no matter what space you're in and will always apply in the care of an advanced illness or progressive illness patient. From that perspective, I really do think it's high value to assure high quality healthcare delivery.
Palliative care for the first 30 years, as it was climbing out of the primordial soup as a specialty, was a lot of people doing the best that they could and using a combination of medical interventions and kitchen table wisdom and kindness to try to help people navigate serious illness. I'm happy to say we're in a different spot now in palliative care. We have an evidence base. There are right things to do and wrong things to do. You can't just get along anymore by being nice to people. Yes, that's necessary, but not sufficient to provide high quality palliative care. I think this course really offers some of the evidence behind the interventions, and it offers a way for people to provide palliative care that's at the tip of the spear as opposed to just this is the way we've always done it.
It's not your mama's morphine anymore, folks. It's changing. We are very modern course. We're updated. We have a lot of evidence based, clinically high value information that we're disseminating to our students that is significantly different than what's out there. If you're interested in learning more about palliative medicine or palliative care and wanting to do that better for your patients, you need to come to where there are palliative care experts as full-time faculty who are the folks that are committed to this and focusing on this, who are clinically practicing in active settings, and then also looking to share that knowledge with folks for that next generation. And I think Dr. Jones speaks to that beautifully with his fellowship program and all the other various areas that he's engaged in as well.
I think so much of education is designed for people who are practicing in academic centers and in the ivory tower. And this program really is not. Not that it doesn't apply, and we've had folks from Duke take the course and enjoy it and learn a lot, but this is trenches palliative care. This is how do you make it work if you are at the community hospice organization that's opening a palliative program? How do you make it work if you were in primary care and now you're landing at Emory on the inpatient consult service? It really does cross in that one room schoolhouse way from community based palliative care through the office, through inpatient palliative care, through hospice, both in the community and in the inpatient unit. There really isn't a place where palliative care or hospice is delivered that content and the education from the immersion course don't directly impact and improve your care abilities.